we are back with Dr. Laura, Naturopathic Doctor, to talk about fertility myths.
And there are many myths out there, aren't there?
There are.
I know personally, there is a myth out there that women can't or have a very difficult time getting pregnant after 40. What is your take on that?
Yeah, and I mean, that definitely I hear that a lot, and that actually, discourages women from starting a family, even though their body and their health may
Causes a lot of anxiety if you're getting close to 40.
Yes, and that, it's kind of a bit of an oxymoron, but you get more stress and you get more anxious, but actually that myth is a myth. It's not true. Women after 35 do start to decrease some of their egg quality, but that doesn't mean that they can't get pregnant. It just means they have to really pay attention to optimal health from 35 and on.
All right, so we touched a little bit on stress. So I'm gonna jump into that myth, because there is a myth that stress doesn't matter.
And let's do a mini science lesson here for a second, because that is also a myth. The more stressed we are, we raise a sort of a hormone in our body called cortisol, our stress hormone. And that, if that's too elevated, it lowers our progesterone. Some women may know that that's a very important hormone for not only getting pregnant, but staying pregnant. So any women that have, recurrent miscarriages or are thinking that they can't get pregnant in the first place, elevated stress levels may be to blame. So
you want to do everything to de-stress yourself, and there's a lot of easy, simple things to do, but let's be honest, having a stress-free life is just not possible for anybody.
That's right.
But what could you do? What are some of the few things you could do?
So I definitely like to incorporate stress reduction in all areas of my day. So, if you're waking up, rushed, you don't want to stop on nutrition. You don't want to give up a good quality breakfast because your morning was chaotic. So start with a smoothie, start early. If you can get up early before everyone else, give yourself a few minutes to quietly breathe and just relax. Starting your day with a hustle and bustle, sometimes I know is not always possible, but a little bit goes a long way with stress reduction. And then continue that throughout the day. A walk at lunch, maybe quiet bath at night if you can, but it's really about you time and taking that time to make yourself a priority.
All right.
And then I've heard that men's health doesn't necessarily play into fertility for women. What do you think about that?
If I had a dime for every time someone asked me that, it is so important to really be aware that men's health is just as important, if not, equally important to women's health when it comes to fertility. So men should also be on a multivitamin. Men should also be managing their stress, and also things like laptop use, on their lap, can really affect fertility levels. So keeping in mind that it's the men does not actually kind of get a free pass here, that it's a joint venture.
It does take two, right?
Does take two.
Well, thank you so much for being with us, and tune in next time for the next and final segment of our fertility series.